Okay, in a hospital, you train for just about everything, right? But a radiation incident, that's one of those scenarios that can make even the most seasoned teams just freeze. So in the next few minutes, we're going to cut right through that fear, cut through the complexity, and give you a clear, simple, and immediate action plan for your very first move. So picture this. The alert goes out. A patient from a radiation incident is 5 minutes away. The clock is ticking, and every single decision matters. Now, your first instinct might be to start prepping for medical treatment, right? But your absolute first move, it has nothing to do with medicine. It's all about asking one critical question. And that question leads us straight to the single most important distinction you have to make because it changes everything that comes next. Are we dealing with exposure or are we dealing with contamination? Getting this right from the start is the key to protecting your patient, your team, and your entire hospital. So what's the difference? Well, it's actually pretty simple, but it is profound. Exposure is like getting an X-ray. The energy passes through the patient, but they don't become radioactive. They are no threat to you. Contamination, though, that's totally different. A great way to think about it is like being covered in radioactive mud. The material is on the patient, and it can spread to anyone and anything they touch. That's a situation that demands immediate action. So if you even suspect contamination, what's the plan? Well, forget those complicated protocols that are impossible to remember when you're under pressure. The most effective response boils down to just 3 simple steps that anyone, and I mean anyone, can execute. And here it is, your entire plan in 3 words. Remove, wash, control. First, you get the patient's clothing off. Second, you wash their skin and hair. And third, you control the environment to make sure that radioactive mud we talked about doesn't get anywhere else. That's it. That is the core of your initial response. And if you're doubting the power of keeping it simple, just look at this number, 95%. Just by removing the patient's clothing, you can eliminate up to 95% of external contamination. It's proof that your biggest impact comes from your first and simplest action. What an incredibly powerful way to start. All right, so let's get back to our emergency department. That patient has just arrived. Let's walk through exactly how to apply our remove, wash, control framework in a real-world management flow. The flow is totally logical and, more importantly, immediate. The moment the patient arrives, you control the situation by getting them into a designated area away from other people. Your staff gets into their PPE, then you just execute the plan. Remove their clothing, then wash them with simple soap and water. And as part of that control step, you make sure you manage the runoff and bag all the contaminated items. Only after all that is done should you move on with a full medical assessment. Now, knowing what to do is half the battle, but knowing what not to do, well, that can be just as important, especially when stress is high. There are 3 really common mistakes that can completely derail an effective response. First, do not rush to treat other injuries before decontaminating. You have to contain the radioactive material first to protect your team and your ER. Second, don't assume every patient from a radiation incident is a threat. Remember our first principle. If they are only exposed, they are not radioactive. And third, don't overcomplicate things. You don't need fancy special solutions. Plain old soap and water is the standard of care, and it is highly effective. Let's zoom out for a second. This whole process isn't just about managing one patient. It's about protecting your entire healthcare system. For those of you studying hospital management, this right here is a critical lesson in operational resilience. I mean, just think about the consequences. A single contaminated patient can compromise your staff, other patients, and your equipment. It could potentially force a complete shutdown of your emergency department. So what this really means is that these simple early decontamination steps, they are your primary defense for keeping your hospital up and running. So what's the big takeaway here? It all comes down to this checklist. First, identify the risk. Is it contamination or just exposure? Second, if it's contamination, decontaminate early and simply with the remove and wash method. And third, through those actions, you protect everyone, your staff, your other patients, and your facility. So the next time you think about a radiation emergency, don't let the scale of it intimidate you. Your most powerful tool isn't some complex piece of technology. It's a clear, simple plan. Remember the core principles. Identify the risk, act early, and keep it simple. Because in those moments, simple decontamination done right away is what truly protects everyone.